This is the very first Techfugees live session. So for those of you who don't know Techfugees, we're a global impact-driven organization working to empower displaced people through technology. So we're a community of volunteers organizing events, running programs, and building projects, not only for, but rather with displaced people. And among these different activities and projects, in April, so a month ago, we started Techfugees Data Hub. So Techfugees Data Hub is a collaborative and collective effort to map the impact, direct and indirect, of COVID on displaced communities. We've been collecting data not only on the spread of the virus, but also on the actions taken by grassroots organizations and government to protect displaced communities, and to list the different and concrete ways people could get involved remotely and support those organizations, those projects working with displaced people. So as I said, this is a collective effort, and we've been more than 50 contributors joining the project since a month, mapping hundreds of situations in 38 countries. So I would like to thank all the different partners that I've joined to be part of this effort, by spending time and collecting data and conducting interviews to understand what's happening. And I'll be quick on the introduction, but these tech are the result of this work, and these are open, public, regular events and discussion to first raise awareness on what is area, so today Asia Pacific, and to promote existing actors working with displaced people and show concretely that there are solutions existing and that there are ways to act. So this event today will be a simple format. We are very happy to have 3 amazing speakers with us today, giving different insights on the regional perspective of what's happening in Asia Pacific. A focus on Malaysia afterwards, with the different challenges happening in Malaysia, concerns and solution, and we'll end with a solution pitch with KitaJagaKita at the end of this live session. So I will ask everyone who's not speaking to mute, and you're more than welcome to ask all the questions in the chat. Each speaker will be presenting their insight and sharing their experience in 8 minutes, and then followed by 7 minutes question and answer. So it will be quite fast. It's a snapshot. There is no wrong question or stupid question. Feel free to interact. And we'll be doing our best to answer all the questions from the Facebook Live and from the people who joined in the Cisco Webex meeting. So without further ado, I would like to introduce you to Jeanne from Malaysia. Jeanne, if you're here, I leave the mic to you.
All right, so hi everyone, and thanks for joining us today, speakers and audience alike. So as we said, my name is Jeanne, and I've been contributing to Techfugees Data Hub since April. I've lived in Malaysia for about 5 years and worked mainly before starting Recode, a refugee coding school. So as Louise mentioned, today we're focusing on the situation of refugees in the Asia Pacific with a zoom in on Malaysia. As some of you may know, a lot has happened in the region, and especially in Malaysia. So some negative with, for example, disembarkation of refugee boats denied, the rise of hate speech against refugees, and in the last few weeks, several immigration raids. But there's also been some very positive outcomes with favorable public health policies, so free testing for all foreigners, regardless of legal status, and quite an incredible mobilization of civil society and individuals alike to help refugees. So today we will have three speakers that are going to give us a snapshot of what is going on in the region. So the first speaker is Arash Bordbar, who is the Asia Pacific Refugee Rights Network Chair and also the co-chair of the Global Youth Advisory Council. He will be giving us a regional view today. Our second speaker will be Hasnah Hussin, who's a volunteer with Tenaganita in Malaysia. She will be speaking in her own personal capacity today about the issues her community is facing. And our third speaker is one of the co-founders of KitaJagaKita, a mutual aid platform in Malaysia that helps ordinary citizens fight COVID-19. So without further ado, Arash, thank you so much for being here. Could you maybe just introduce yourself and kind of give an overview on the impact COVID-19 has had on refugees and also on policies in the region?
Oh, thanks, Jeanne, for a kind introduction. Firstly, thanks for having me in this session, and thanks Techfugees for organizing this. I think it is very important and very interesting to be part of. So my name is Arash Bordbar. I'm originally from Iran. I'm actually a former refugee, lived in Malaysia also for 5 years. I got to Australia, where I live now, Sydney, less than 5 years ago. I work, as you mentioned, with different organizations, but I will try to bring my own personal perspective, especially around impact of COVID-19 in this situation around Asia and the Pacific, through the work that I have been doing with the Asia Pacific Refugee Rights Network and also the Global Youth Advisory Council. So maybe to give a little bit of background, we know that Asia and the Pacific region hosts more than 9.4 million forced migrants, that include refugees, internally displaced persons, asylum seekers, stateless, and others. However, most forced migrants in the region suffer from lack of international and regional protection mechanism. Maybe, for example, we know only 6 states in Asia ratified the 1951 Convention, which is the Refugee Convention, such as Cambodia, China, Japan, Philippines, South Korea, and Timor-Leste. So Asia's refugee protection policy exists in a very unique political environment, and most Asian states are very reluctant to comply with the international refugee laws and norms. There is a very interesting dynamic in Asia and the Pacific. For example, we know in different parts of the region, few states have very similar politics and policies when it comes to forced displacement and refugees. Southeast Asia, for example, Malaysia, Indonesia, and Thailand, most of the times are very similar in terms of their reactions and policies. Similar goes to Korea and Japan, Pakistan, Afghanistan, and India. And we have Sri Lanka, we have on the other side, for example, China, and Australia and New Zealand. So it's very different when it comes into different parts of Asia, but a lot of the neighboring countries have very similar policies when it comes to that. Our world has really changed dramatically since the COVID-19. Unfortunately, many actors are taking needs-based approach in responding to COVID-19 rather than the rights-based approach, which puts refugees and forced migrants at the last edge. The people around the world have been asked to take, precautionary measures as simple as hand wash with soap, social distancing, or simply calling the doctor. But the question is, do refugees have access to a phone to even call a doctor? Do those in camps have access to any primary health? Are refugees privileged enough to have even clean water in some areas? Do refugees have space for social distancing in detention centers when dozens are pushed into small cells? Do they receive ongoing health alerts the way that we do, through social media and via internet access that we have? Also, do they really have any safety protocols to follow. For example, social distancing is difficult in the Kutupalong camp in Bangladesh, where over 600,000 people living in an area of just like 13 kilometers square. I think regardless of their legal status, refugees and migrants are the human. That's how we should really look at it from outside. They're susceptible to increased vulnerabilities relating to access to healthcare, testing, and prevention measures, and are often confined to restricted spaces without adequate access to life-saving support. There has been a major shift in asylum and resettlement policies. The normalization of restrictive policies enacted during the COVID-19 pandemic is expected to really contribute to the continued blocking of access to asylum, which we have seen in our region. On the other side, when we talk about the resettlement process has stopped, which is sometimes the only hope when it comes for the refugees to actually get to a safer place. It has stopped during the restriction on traveling, which may really cause a big delay and challenge for not only refugees but also for UNHCR. They are still, I know, referring to different countries. For example, Australian government said they are still receiving referrals, but they will not be able to resettle anyone yet. And they won't also be able to fill their humanitarian quota, for example, for this year. The other issue that comes with it also, as we know, there were a lot of the refugees that were due to depart. When it comes to that, you usually sell your furnitures, you give away your house. So you were waiting to depart, and suddenly with all this restriction, you're left out in the limbo. And I know, for example, UNHCR is trying really hard to address those issues. But we see in these circumstances, community themselves are the ones that are at the forefront and able to help those refugees that are stranded. COVID-19 had a significant and detrimental effect on the lives of refugees, leaving many subject to destitution without access to employment or inclusion in relief packages. And this is compounded by the fact that restrictions on movement intended to curb the spread of the virus, in addition to refugees and asylum seekers in camps and also in detention centers. This provides a little access to the population of displaced communities in Asia and the Pacific. On the other side, we have seen a big trend in terms of reaction towards refugee community. I'm really not expert. We also have Hasnah on the call, but we have seen a rise of xenophobia and stigmatization that comes with that. In a recent mistreatment of the African communities, for example, that we have seen in the Chinese city of Guangzhou, where they were targeted and forced to do a lot of tests and being mistreated on a lot of the spaces where they were living. In the month of April, we saw a sharp rise xenophobic and anti-Rohingya sentiment and hate speech on social media platforms and other forms of media by some users in Malaysia. And the backlash really sparked after Malaysian maritime authorities refused to allow boats of Rohingya refugees to disembark on, I think, 16th of April. And a quote was distributed that the head of the Myanmar Ethnic Rohingya Human Rights Organization, which he allegedly demanded Malaysian citizenship for the Rohingya. And this statement was strongly denied by him. And that brings us into a situation where sometimes a representation is so important. I will not be able to represent all the Iranians, as well as I won't be able to represent all the refugees. I can only represent my view and the fellow that I work with. However, encouragingly, a number of high-profile Malaysian individuals and also organizations have come forward to show their support for the Rohingya, including the PKR party president Anwar Ibrahim, the Bar Council of Malaysia, and the Malaysia Consultative Council of Islamic Organization. So I think when we look at it in a different area of Asia and the Pacific, that idea, that narratives around refugees has come there. And usually the governments tend to look for more, excuses to really try to have that in the political situation. I know that it's really hard. The impact is on all of the people in our region, but we really need to be careful because a lot of the times refugees in an area where they did not sign the 1 convention, they're scared to even go out for the testing. So that is one of the other big challenges, that they won't be able, even if the services were there, they will not able to go out because of fear of getting arrested. So maybe I'll just leave it there, and if there was any more question, I would be able to address. I know the time is very limited.
Thank you so much, Arash. That's very insightful. So maybe I'll just ask Louise if there are some questions from the viewers. Let me check. But in the meantime, I think one of the questions that we had was, you know, we touched a little bit on the, I guess, the xenophobia. And do you see this will or has already spilled over in other countries? Like I saw recently, there's been the representative of the ASEAN Intergovernmental Commission on Human Rights from Indonesia, who's issued a statement expressing concerns over Malaysia's decision to arrest and detain refugees and migrants. So do you see that everyone is kind of going to go in the same direction, or that there is a potential for other countries to maybe choose slightly more favorable solutions for refugees at the moment?
I think we do have seen that not only in Asia Pacific, in other regions, we have seen that, for example, saying refugees are the ones that are bringing COVID-19, and a lot of different things that are a lot of times not done really by the community. It's done by single people. And that's the challenge, that you would see somebody use this as an excuse to really drive an agenda, a hidden agenda behind it, which is most of the time very political. I think on the other side, Bangladesh and Malaysia alone cannot rescue and provide protection for Rohingya refugees, especially now that the topic is around rescue at sea. A comprehensive regional response to conduct life-saving search and rescue missions and provision of humanitarian assistance must be initiated. So it would be really a regional approach that is needed, not only to combat the xenophobia, but to really be able to address the needs of the people right now. We have to consider that, I know, for example, COVID-19 is there, but it doesn't mean that the war has stopped. It doesn't mean that the racism has stopped. It's still, for a lot of the nationalists and very, very far right-wing people, use this as an excuse to drive their own agenda, unfortunately. And maybe just to add a little bit in, a lot of the times we have seen, especially during COVID-19, the rise of refugees themselves and displaced community to be at the forefront and responding not only to xenophobia, but to really, as nurses, as community workers, as doctors, and as campaigners, to tackle these issues. So it's really, really important to make sure in whatever response we have, we include those affected populations.
Thank you. Thank you for answering the question. And next one, which is, do you see this as, do you see this as a trend to have more and more refugee-led and thought about solutions? And do you think that these are the solutions that that would be completely refugee-led?
Yeah, it's very interesting. I mean, there are few very effective initiatives that happen not only by refugee-led organization, by different networks, and by refugee communities themselves. For example, I have seen that a lot of people started creating soap and mask at home and distributing in the country. I know, I mean, even in Malaysia, a lot of the refugees themselves were packing food packages for not only the refugees, but also for the broader community who are in need. So you can see a big rise of refugee organization, because they know that, to be honest, I mean, I think, when it comes into the response in those diseases, I really appreciate a lot of organization and states put different language in providing the information. But when it comes into action, most of the times, refugee community themselves are the one that actually have direct access to their own community and know what's best for them. So involving and supporting and investing in the refugee-led organization and networks would be really helpful in bringing that solution.
Thank you, Arash. So I think this is perfect to get onto our next speaker. So Hasnah, thank you so much for being here today. Today you'll be talking mainly from your own personal experience and what you've seen within the Rohingya community or other refugee communities. So if I can ask for you to introduce yourself and maybe share a little bit of a snapshot on how your community has been impacted by COVID-19.
Okay, first of all, Assalamualaikum everyone. Hi, my name is Hasnah Hussin. I'm born here in Malaysia and my parents are from Myanmar and Rohingya refugees. Even though I'm born here, I'm still a refugee. Just to remind everyone. Anyway, I'm working currently as a volunteer community mobilizer with Tenaganita, one of the NGO in Malaysia, to promote and protect the human rights for migrant, refugee, women and children. So I have been working closely with migrant and refugees since I have joined Tenaganita 2017. And since before that, I have been working with different organizations in order to work on humanitarian grounds. So Tenaganita, it's not only working on migrant in particular or refugee. They're also working with Malaysians who are in need. Basically, it's all about human right. If there is any needs of human right to be addressed, we will be there to help out. So talking about my personal experience during this COVID-19 pandemic issues, community, as refugees community are in great fear, not only on starving, lockdown or others, but it's also arrest and detention. Arrest and detention has been very active since last 2 weeks. If I may share, last 2 weeks, Selayang, Pasar Borong area and Pudus area are being targeted by the authority to arrest and detain those who are undocumented. We are trying our level best to get documentation for those who are undocumented in terms of refugee community or migrant community. But we also know that there are migrant community such as Bangladeshi refugee, Bangladesh migrant who are working in Malaysia legally before they become undocumented. There was undergoing rehiring program where they become undocumented because of the rehiring program stopped by the government of Malaysia. So in our understanding, they are not undocumented. They are documented but delaying of their proper physical document because of some error in the authority session. When it comes to refugee in particular, I'm working closely with Rohingya refugees since the pandemic started. And if you ask me the impact of COVID-19 to the community, it's been very drastic and unexpected. We did not realize that we are living in a country where there are some group of people who hate us so much. These are some of the quotes come from the refugee community. They are so fearful to even go out and take the help that they're supposed to be received. They receive harassment by the neighbors, they receive harassment by the landlord, but what they can do at the moment is just to be patient. They can't pay the rent for last 2-3 months. They're hardly feeding their family members, but still they follow the rules and regulation by the government that you have to make sure you don't go out, wash your hand, keep your distance, but they are doing as much as they can. Like our brother Arash has shared that refugee community are living in a shared apartment, shared area where there are crowded places, such as Bangladesh refugee camp. Even in Malaysia, there are houses where 3 rooms apartment shared by 5 different family because they are renting hall, they are renting kitchen, so they will live in one big community and they can't keep social distancing. So what they can do is just to keep themselves hygiene and also to follow the rules and regulation that directed by the police and immigration in Malaysia. Like last week's when the arrest and detention happened, I'm sure many of you are aware of it. You've seen the news in social media, in printed news. There were so many pictures that show you that the authority bring everyone together, stay in one area, no social distancing, no face mask, no hygiene item, no sanitizing, but they are all in one place, including children, elderly person, and also the disabled people. So my concern at the moment, at that time, was I was very upset that how could a government do that? How could an authority do that without even concerning the needs, risks of the children and the older people who are above 60 and have many kind of illness? But then when I dig in more to the information, it seemed like there has been ongoing medical access given by the government house to house before they was taken out from their house. So the authority was well informed and sure that none of them were positive with COVID-19. But I was still very upset, not mad with anyone, but upset because this is a holy month. And during this holy months, everybody is fasting and arrest and detention happen. So the stressor level that the refugee community and undocumented migrant community going through, it's unimaginable. We can't imagine how much of stress a mother, father, family member are going into. And due to this stressor, some SDVV has been reported, but it's very underreported because I'm also aware that they can't do any reporting in front of the perpetrator or the stressed person that they are facing to. So what my concern here, it's discontinue. Many people will lose their job first. Because they lost their job, they weren't able to feed their family. I know there were so many comments on my social network saying refugees and undocumented migrants are burden to Malaysia. But one thing very clear from my research is refugees are burden if you arrest them and detain them, because you have to feed them in detention camp. You have to look after them in prison. Even though they are going through prison, there are some refugees who was arrested more than 3 times. All the process from the beginning, arrested because of undocumented, sentenced for 6 months, more than 6 months in detention camp until UNHCR come and release them, or the embassy come and release them. So this circle going on and on for refugee in particular, because refugee, for example, Rohingyas, Palestinian, Syrian, they can't return to their hometown. If they return, the only fact gonna happen is death, because there is a big conspiracy going on in each country to demolish certain ethnicity. So it's better for us to stay in this country for time being. We know we are guests in Malaysia. We really appreciate. I'm someone who born here in Malaysia. I never faced this level of discrimination or harassment from the Malaysian fellows, because what I go through from my childhood, Malaysian has been very kind. Honestly, wallahi, they has been very kind, very supportive, accepting others regardless of race and religion. But suddenly when I see all this xenophobic, it's actually break my heart. It's not only from the humanitarian look, it's also as a mother to a child and a daughter to my parents. I really feel broken when I see my fellow Malaysian who was supporting me once upon a time now suddenly turned to hating me just because I'm working for the refugee community and migrant community. That's really break my heart. So from internal, what I can see, the xenophobic, it's killing humanity faster than the COVID-19 killing the human. So that's from my side. I will leave it the mic from here.
Thank you so much, Hasnah, for sharing. So you've obviously raised a range of issues, among them xenophobia, kind of being able to buy food for survival, lack of access to rights, issues accessing services like SGBV services, for example. So in your view, what solution would be needed right now to kind of be able to resolve at least some of these issues? And is there a project in particular that you want to talk about that would need support and that we can talk about, that we can raise here?
At the moment, we have fundraising and food distribution going around. So I think one of the solutions to keep the community at least survive, not starving, by giving them food from whatever donation that we got. It's not only from Tenaganita. We are collaborating with 3 other organizations. Second organization is Refuge for Refugee. Then 2 organizations from Malaysian base, which is Dapur Jalanan and Liga Rakyat Demokratik. 4 organizations coming together. We do fundraise. We are buying groceries. Most of the time it's dry items such as onion, potatoes, rice, eggs. So we are trying to distribute not only to the refugee community, also for migrants, regardless of their documentation, and also for B40 group in Malaysia. So other than that, we mean Tenaganita are also collaborating with UNSW, University of New South Wales, together with other few NGOs in Malaysia, to work and empower the refugee women's leader in terms of supporting and participating. So we are currently trying to reach out as much as women possible to find out what's going on in the community, how we can assess the community, how we can assist them, like in particular on their mental health. We are currently looking into donors or donation for safe house, because we know if we open the SGBV counter, definitely there are going to be a lot of SGBV cases, sexual and gender-based violence cases, due to this COVID-19. And normally women or the victims or survivors are fearful of losing their shelter, especially in this pandemic time, when they don't know where they can go to, no neighbor, no relative will able to help them. So we need to shelter them in a safe house. And we don't have budget for the safe house. We are currently working together with UNSW to get more funds so that we can work with whether the local budget hotels or residents, private residents, residential, so that we can temporarily shelter them, like safe house, at least halfway house for the SGBV survival, whether it's women, men, or children. So that these are some of the initiatives that we are trying to do. From my personal level, I can only help my community by supporting them in terms of encouraging them to speak out, because many of us know how we are afraid to speak out. Keeping so much thing inside us will blast one day. And when you are keeping too much things, like currently a father can't feed the children, they leave the anger or throw the anger to the wife or the children. But what we can do, what I can do, is to speak to the husband and see what help can be done. It's not necessarily money. Sometimes a social support would really help, including if one day I'm what I can say is, like, me and my other organizations, fellows, NGOs who work together to empower Malaysian citizens, Malaysian people, to understand what difference between migrant and refugees and why we need to care about humanitarian ground. Once they realize, once they are aware of it, if they started to support the refugee community, I swear it won't be a burden to them, because it's on supporting each other. It's more on like giving your hand, not to pull them out, but at least to make them confident and comfortable that we are with you, rather than abusing that person more and more.
Thank you, Hasnah, for sharing all of this. And also, we will be very happy to share these projects that you've mentioned to see if we can gather some support for it as well. There's a question that there's been a lot of message of support on Facebook, so I wanted to share that as well. But there's also a question from Josephine, who is asking, given you were born here and considered a refugee, do you see yourself as one day being able to be included as a resident here in Malaysia, or do you feel like what's happening is kind of preventing you from ever projecting yourself as local?
Okay, this question been asked many times, and I think I'm not tired of answering it. Okay, let's deep a little bit about myself. I can speak 7 different languages, and I belong to none of the country. I am refugee because my parents are refugee. If my parents were not refugee, I would be stateless. So I used to have identity crisis when I was growing up in Malaysia. I was very upset that I'm not a Malaysian, so that I can go to school. I want to learn more. I want to be one of them. But growing up as refugee woman, now I realize that I cannot be a Malaysian or even permanent resident. This is not my place. If one day Malaysia government recognized 1951 Refugee Convention, I will be still refugee and staying in Malaysia, not only contributing to my community and my society, but also to contribute back to the Malaysian government. But seeing myself as Malaysian or residing in Malaysia, I don't think so, because born here in Malaysia, 28 years of experience living in Malaysia, I don't see anywhere near to be a Malaysian or even temporarily resident in Malaysia. I'm just a guest in Malaysia.
Thank you so much, Hasnah. I think some of the things that you've said around, you with your organization, you provide the organizations that you're with, you provide assistance to refugees, but also to anyone else that needs food or hygiene items and things like that. And the next organization that we're going to talk about really embodies this idea that COVID-19 has affected all of us, and that, we have to fight it together regardless of race, ethnicity, or nationality. So introducing the next speaker, Hafiz. Thank you so much for being here. So Hafiz is one of the co-founders of KitaJagaKita. Could you please introduce yourself and explain what KitaJagaKita is?
All right. Hi, everybody. Thanks for having me. So I'm Hafiz. So basically, I'm one of the co-founders of KitaJagaKita. KitaJagaKita basically means we helping ourselves, or we helping others together, something like that. It's a Malay term in English. So I have a presentation to show you how it works and stuff. So it's essentially an initiative that aggregates civil society effort to help those in need, especially including migrants, workers, as well as refugees. So let me pull it up a little bit. Do you see it right now? Yeah. So, great. So like I said, KitaJagaKita, if you want to take a look at it, you can just go to KitaJagaKita.com. You'll see what it's all about. But in the meantime, so this is how it looks like on mobile. So what it is, really, like I said just now, is trying to aggregate as many as possible civil society effort to help a lot of vulnerable communities. It could be the poor, it could be urban, it could be the indigenous population that somehow slipping out of the safety net. It could be the refugee community as well, which the government really very reluctantly is addressing the concern over there. So okay, what KitaJagaKita is that, I mean, the model has proven to work. For the past 2 months, we have had 50,000 users. That basically means people helping out, giving money, giving cash, volunteering, or also sometimes people asking for help as well. And we have quite good social media reach, and we have a lot of media what we call that, coverage so far. So that's helped us help other people in many ways. And so the whole situation started when Malaysia first started the lockdown. So basically, a couple of us realized that if there's a lockdown, people cannot go to work. There's a lot of vulnerable communities that just cannot afford to not to go to work. So they couldn't buy food, they couldn't pay their rents, they couldn't do whatever else they need to do, their loans and stuff. And one of the most vulnerable people are really the refugees and migrant workers. There are about 200,000 refugees in Malaysia. About 150,000 of them are from Myanmar. The rest are from Palestine, Sudan, Somalia, Iraq, all those places. And then officially there are about 2 million migrant workers in Malaysia, but unofficially it could go as high as 6 million people. So this is quite a huge number if you consider that the official population number in Malaysia is about 32 million. So 6 million is about 5%, 6% of the population. And so a bunch of us realized this was happening, and the government is just not doing enough to help a bunch of people. And in fact, there's a feeling that the government doesn't really care about something, or that they weren't thinking about it. So there were a lot of civil society effort to address the gap. But the problem is there were so many initiatives, they get confusing after a while. And people that want to help really don't know what to do. So we figured out that if we somehow provide a platform to list all the initiatives that exist among civil societies, and all the users can just go to the platform and just search their favorite initiative or look up for people that they want to help, then that would help the whole society as a whole, make civil society more organized. So that's what we did. So we came up with a one central platform, that you can call it. It works on the desktop, it works on mobile, and it's especially important because in Malaysia, mobile penetration rate is quite high, even among some of the vulnerable communities. So, but what makes us different is really that there's a lot of lists out there, but what we different is that we allow the list to be filtered and to be searched in a proper way, so it's become user friendly. So when it comes from family, a lot of people that want to help will be able to help. The problem with a lot of people that don't want to help is that they get frustrated just searching for the solution. So we lower that search cost for them. And I think that has been proven with our numbers, which is about 50 million people, 50,000 people using the website. And then that hasn't really include those that know about the initiative to us, but didn't go to our website. So this is one example how it works. So if you go on the website, you could filter it out based on your what you want to do. If you, for instance, if you're interested in a refugee migrant, you want to help them, you can just click on the filters, and then they will come up. So this is one example. For refugees was mentioned by Hasnah just now. So this is it. There are a couple of others. There's about 140 of initiative. Probably about 20% or 10% or 30%, I can't remember, of them are related to migrant workers and refugees in Malaysia, either donating cash or donating food, or just them need help in some ways, in terms of counseling, in terms of legal representation. There are a bunch of them inside. So talking about migrant workers and refugees, I think the first two speakers will talk a lot about it. But what we saw from our platform is that there are pretty much three things that they need. Food, because they can't go out to work. It's really a challenge to find food, and they're actually starving. And second is rent. The couple of organizations are working to help them pay rent, because or else they will be evicted. And if they're evicted, it would make the problem worse. And the other thing is really essential: soap, glove, mask. And this time is also important for them to go out and in some ways adhere to the regulation that the government is imposing. And what we found is that you have these three things that they need. Most of the time, it's really easiest to give cash to the organization, because food, for instance, could go bad if you don't eat food, especially the non-dry ones. So cash is easy to manage for a lot of organization and for the recipient of it as well. And so for our platform, there were a couple of things that helped us grow. First of all, we don't try to compete. When we first started the project, we learned that there's a lot of civil society initiative, and that we have no way to compete. We have to know way to do as good as they can do. So, but what we realized really there was a gap. So again, like I mentioned just now earlier, there's a lot of initiative, and then if people want to help, they just don't know where to go. So we provide that service. We cover the gap. We provide matching services for the users, for the potential donors and organization. And that really, because there's nobody else doing it, that really helped us grow in Malaysia. Secondly, you really need to communicate with the activists, with the people actually doing work on the ground. For instance, Refuge for Refugee, Liga Rakyat, we just pull them up when we just get the requests and just push them towards the organization that can do it. But we also, in the background, there's also a bunch of chat groups among communities. There's probably hundreds of people inside of it. So if there's something happen, the people can just, ping somebody up, and there will be somebody that will be able to help in some ways. So that's also important, having a network. You can't just do a platform, but you also have to have a network, you have to know people on the ground as well. Second, the third issue is really having a consistent social media presence. This is important for the user side, because again, the unique selling point of our platform is that we provide users with a platform where they can go and not get confused. So one way to do that is to introduce ourselves to users in social media. And Malaysians are they do use social media too much. So it's a good platform for us to introduce the service and help them to help other people. And then, of course, we have to have volunteers behind the scene. And we have been lucky to have a lot of capable volunteers. Yeah, the people that are important are those doing tech. Without these people, the platform wouldn't work. And then you have to do data entry to put all the initiative inside. And then you have to marketing with all these relevant people, meet up with the organization, have communication. Sometimes you have to communicate with the government, because the government sometimes just not clear what's going on. And so we have people doing strategy. But I think there's also media exposure, which is also important about having more people knowing us and using the platform. But I think the most important part is really trust among people, because if you think about the refugee situation, for instance, they live in fear because they don't trust a lot of people. So it's important for us to build up trust among people. But one of the way we build trust among our users is that to make sure that all the initiatives that we release in our platform are actual people that helping people and not scamming the donors. There are cases outside where they list up the initiative, but it's just a scam. So that is also just a danger, and a lot of users don't like that. So what we do is that we tell them, look, we look all these initiatives on our list. Before we list them, we check them out on the internet, we check their reputation, we call people up, and once we are satisfied that it's verified that these people, the money that if you're going to give, will go to the people that need the most, then they will willingly give the money. Malaysian, I think a lot of Malaysians are generous, but they are scared about being scammed. So this is what makes us special. We vet our initiative. So,
Hafiz,
yes.
if you don't mind, because time is kind of going quite fast,
Right.
there are a few questions from people, and I think because I've seen your slides, you will be able to kind of continue with some of your slides.
Yeah, sure.
So if I can ask, what are the different ways to help that are available on the platform, and how can people get involved? And can people individually, so like refugees individually, use the platform, or it's only meant for organizations?
Is for both. Organization can, I mean, a lot of organization will be just listing an organization and the initiative. So the organization will be the one that lists their needs. Either they want cash or food or volunteers. On the other side, they also a feature that allows for individual that need help to go through the list and see what help there is. I mean, we are unable to help these people themselves, but the organization are able to. For instance, Tenaganita, if I'm not mistaken, have counseling services or women's aid organization that based in nearby in KL. They also provide counseling services, and then the other. So basically, individual can go up and look at the initiative and just basically ask for help in whatever ways. You just have to. It is available on the platform.
And I think someone raised a very valid point, which is there is a significant portion of refugees who are not necessarily literate. So at this stage, can the platform be used by those who are not literate, or is this something that you have planned in the future? Or
I think there's one weakness of the platform right now, but also it's important to understand that what the real stuff in terms of assisting, providing aids, and helping people is really the organization that can list itself. So we provide basically I mean, to be fair, the focus is really up to the donors, but people who don't need help can go as well. But if you really need the help, it's really the organization on the bottom. So yes, if you are illiterate, it will be difficult to use the platform. But also, like I said just now, it's important to understand that it's the organization that do the work, and the organization would have the network to address those needs. All right. So just moving on, there are other initiative that's sprung from our initiative. Basically, this providing accommodation, for instance, and providing masks and PPE equipment. So there are other collaboration that helps bring in donation, and there's a coverage. And then there's the one point is that their model is being replicated elsewhere. We have spoken to a couple of people and in other countries, and they're also interested in to do whatever we're doing. So, but the thing is, if they want to do it, they have to do from the bottom. But the thing is, we have a proven platform that can work. It's a template essentially. So what happened so far is that there are 3 different KitaJagaKita version out there. The one in Malaysia, the one in Germany and Austria, and recently launched this week, if I'm not mistaken, is from India. So what they do is that they talk to one of us, and we just provide them with the template, a little bit of what I call that, tips, and they just go on from it, and they innovate from the platform themselves. Like in terms of Germany, they are able to filter initiative up down to the zip code or postcode, which we don't do in Malaysia because it's a bit hard to do that. And in Germany, for instance, they are becoming very successful. There's about more than 1,000 initiative listed, which is more than ours, which is about 150, 160.
So that's quite a big achievement that that's inspired a few other similar initiatives. And we do have like a one last question, which is, what kind of help would you need right now to be able to continue the platform, and kind of what's next for KitaJagaKita?
Right. This isn't the cost is apart from the volunteers doing the work themselves. We so far have spent less than 200 ringgit, 300 ringgit, which is less than, what is that, 50 euros on managing the account for the past 2 months. And about 800 ringgit of it is really about marketing, buying ads on Facebook to reach more people so that they can help. So basically trying to maintain presence so that people continue going to the website and help. And because right now it's run by volunteers, we are unsure yet how we're going to go forward. But so far, again, the cost is very low. It's just probably going to go on forever, and volunteers can just do whatever they do. And there's a lot of people that would help anyway.
You have a photo of your whole team a little bit later if you want to show everyone.
Yeah. So like I said, it was about 4 or 5 people that came on board initially. So these are the team. So right now there are 12 of us. Each of us are doing certain things. For instance, I generally do the data entry. So I am the one that try to vet the submission or whatever initiative there is and list it on the website. And Tim, for instance, is the IT person. Hannah is the one that make the whole exercise known to the outside world. She's really good at it. And Andrew and a bunch of others people are, Andrew, for instance, are the one that talking to other people outside the country that is replicating the model in Germany, in Austria, as well, and in
Well, thank you so much, Hafiz, for taking the time and kind of telling us more about KitaJagaKita. I don't know if I pronounced it properly.
Yeah, that's right.
I mean, congratulations. It's an incredible platform. And like I said, I think it really embodies, kind of the Malaysian spirit of helping everyone, regardless of race, nationality, ethnicity. So thank you for being here. And thank you to all the other speakers and to the audience. I will give the mic back to Louise.
Thank you, Jeanne. And yes, thank you, Hafiz, Hasnah, and Arash for the presentation. And thank you, Jeanne, for the brilliant animation. We were more than 50 joining this meeting today. It is the first one. There are going to be others on different geographical focus. The next one will be about the US and Mexico border. Forward with this intervention is that several ways of getting involved have been said by Hasnah, whether it's by donating for a housing project, by Hafiz, whether it's just spreading the word about existing solutions that would make the life of displaced people easier. The work that we've been doing with the Techfugees Data Hub is also to list all the existing solutions and ways that you can support, whether it's by donating, by spending time, by sharing your skills remotely, or communicating about existing solutions and sharing the best practices in between different countries and location. So my 2 message to end this first live session will be: first, go and check the different solutions that are available on the Techfugees Data Hub website. I will be sharing the link in the chat for everyone, and you'll be receiving some information also if you register to this event. My second message is we are looking for always more contributors to join. It's a volunteer-run project, and we really want to spread the word about what's happening currently, because so if you want to join, just ping us. I'm sorry we couldn't answer all the questions, and thank you for everyone who has been asking questions. We can continue the conversation on the Techfugees Facebook group, and you can reach out to us so that we can connect you with the relevant persons. Also, I wanted to say sorry because there was a small technical issue with the Facebook Live. So for the ones who are on Facebook watching, this one was registered, so you'll be able to access it on the Techfugees YouTube channel. Once again, thank you so much for all the contributors who enabled this to happen, to the 3 speakers and to Jeanne. This is it for today. I wish you a very good evening or day for depending where you are, and we'll keep in touch. Thank you.